You just heard about how to make yourself happier. But what if you have anxiety, you have depression, and you need more help? We've got Dr. Sherry Tenpenny here to help you. She's got some really interesting ways that you treat patients that are quite unusual, and you are the owner of Tenpenny Integrative Medical Center.
Right,
right, in Middleburg Heights.
In Middleburg Heights,
yes.
Right.
So tell us about some of the things. If I were a patient coming in with anxiety or depression, what would you do that I might not be used to hearing elsewhere?
One of the things that we do is a really rather unique type of urine test that what it does is it measures the amino acid levels in your body and it measures the neurotransmitters in your body. Now, amino acids are the building blocks of neurotransmitters. And the best way to kind of think about neurotransmitters is that there's two kinds. There's excitatory and there's inhibitory. It's sort of like the gas pedal in your car and the brake in your car.
Okay.
So if you've got too much gas, you have anxiety, you have insomnia, you have all those sort of things of too much acceleration. And if you have too much brake, then you have depression, insomnia, sleep disorders, you know, things like that. So you want to have the balance between the gas and the brake. And if those two things can be in balance, then you don't have depression, you don't have anxiety, you can sleep, you get your libido back. I mean, there's all kinds of balance.
Are you hearing this? Okay, wait. This all happens from a urine test?
From a simple urine test, yeah.
Okay, any other tests that you use to?
Well, we also can use a saliva test, and the saliva test actually is the state-of-the-art test for your adrenal glands. Because if your adrenal glands are super high, you have anxiety, and if they're super low, you have fatigue and depression. The state-of-the-art of that is that you do 4 saliva tests over the course of the day. You do it at home.
Okay.
Breakfast, lunch, dinner, and bedtime, and it's the shape of the graph that's important. Your cortisol level your hormone levels should be high in the morning and low at night.
Okay.
And if there is an abnormality there with both the urine test and with the saliva test, we use a set of supplements that are amino acids, and the program is usually about 4 months. It isn't something you have to take your entire life.
And it just gets you back on track?
It gets you back on track, and because it's targeted, we know exactly what it is that you need. You don't have to use a shotgun approach to get yourself better.
Interesting. Now, what about vitamin D? Because I'm always hearing about that affects depression or, you know.
Yeah, you know, over the course of the last maybe 2 years, there's been a large number of studies that have been done on vitamin D. And there's a specific type of vitamin D level. It's 25-hydroxy vitamin D. And that level should be at least 50. And I know a lot of people go to their doctor, they get a test done, the nurse calls back and says it's in the normal range. Well, the range may be anywhere from 20 to 200.
Okay.
That's a huge range. And it's maybe you're in the normal range but not the ideal range. So I always encourage everybody that when you get a test done, if it's your vitamin D test or any other test, you should get a copy of that for your records.
Okay.
And that you should know it should be at least 50.
You know, I got to tell you, I love having you on because I always tell the guests tell the viewers, certain guests, make sure you have paper and pen.
Right.
You're one of them.
Oh, thanks.
Now,
Thanks.
You're going to be very impressed with this. Oh, yes. I take cod liver oil.
Good for you, because cod liver oil has a lot of D in it. That's very good.
And 1 teaspoon a day?
It depends on the type of cod liver oil,
Okay.
and we'll tell it usually on the side how much D you're getting in a teaspoon. But with the cod liver oil, you're getting all those omega-3s. And omega-3s are also very important for depression. Some of the studies show that getting your adequate amounts of omega-3s in your diet is more effective than Prozac or any of the antidepressants.
This is why I'm so happy. It's
There
the
you
cod
go.
liver oil.
There you
Sherry,
go.
thank you for coming on.
You're
You
welcome.
always give us such great information.
Thank you.
If you would like to get more information from Dr. Sherry Tenpenny, you can get a hold of her at 440-239-3438 or log on to her website at tenpennyimc.com. We'll be right back with Rate Your Relationship.